How to find the right chiropractor for a herniated disc without rushing into surgery. Introduction. That one lift that changed everything. Welcome back to the After Injuries podcast. If you're listening to this, there's a really good chance one moment changed how your back feels every single day. Maybe it was a box at work, a suitcase, a kid, a barbell, or just something you twisted to grab off the floor. You felt a grab, maybe a pop, and since then your lower back hasn't felt right. Now you've got pain, maybe tingling or burning running down one leg. Sitting is miserable, and somewhere in the back of your mind is that one word: surgery. Nothing in this episode is meant to diagnose you or replace an in-person exam. I'm Tom, the producer. We're here to help injured people cut through AI, search, and social noise to match with the right local chiropractor for their specific injury. We do that because we work with chiropractors directly, and I've worked with personal injury law firms for decades on how they show up when you're hurt and looking for help. Today, we're talking directly to you if you hurt your lower back lifting or bending. You've got pain, numbness or tingling running down one leg. You're seeing words like herniated disc and bulging disc, and you're searching sciatica. And you want to avoid surgery and injections if you can, but you also want your life and work back. Over the next 10 minutes, I'm going to walk you through what's actually going on with a disc injury in plain English, how to search for the right local chiropractor or disc-focused clinic, how to qualify them, and what to ask for before you ever book that first visit. Part 1. What a herniated disc really is, without the scare tactics. Let's start by making sense of what's happening in your back. Between each bone in your spine, you've got a disc. Think of this disc like a small cushion, tougher on the outside, softer on the inside, designed to absorb shock and let you move without bone grinding on bone. When people say herniated disc, bulging disc, or disc protrusion, they're describing different degrees of the same basic problem. Some of that inner material has pushed outward far enough to bother a nearby nerve. That's why your problem isn't just a sore back. With a lumbar disc issue, the pain often has a pattern. It might start in your low back, travel to your buttock, then run down the back or side of your leg, sometimes into the calf or even the foot. That radiating pattern is what most people mean when they say sciatica. Here's the part that often gets lost in that fear. A lot of herniated discs do not automatically equal you must have surgery. Many disc injuries can calm down over time with the right kind of conservative care. Things like specific chiropractic work, decompression, physical therapy, smarter movement, and changes in how you use your body. Surgery absolutely has a place, especially if you have certain red flag symptoms, but it's usually not the first step in the journey. So, your real question isn't just, do I have a disc problem? It's who should help guide the first phase of dealing with this disc problem before I jump into procedures I can't undo. Section 2. Why chiropractor near me isn't good enough for disc pain. When your back is on fire and your leg is buzzing, you don't feel like being a researcher. Most people grab their phone and type chiropractor near me. Best chiropractor in Fort Myers. Best chiropractor in New York City. Best chiropractor in LA. Or your neighborhood. and then they click whatever is closest or has the most stars. That's been the historic model. For simple stiffness or everyday aches, that might not get you into too much trouble, but a true disc problem with leg pain is not a quick in and out situation. You don't want a random provider. You want someone who actually works with disc and sciatica cases on a regular basis. A good disc chiropractor or disc-focused clinic is going to do a few things differently. They'll take a real history of how this started, not just ask, where does it hurt? They'll test your movement, strength, and nerve function. They'll look at any imaging you already have or help you decide when imaging makes sense. And they'll talk about a plan that respects the fact that a disc takes weeks to calm down, not a single visit. Not every chiropractor practices that way. Some focus on wellness tune-ups, some on general neck and back pain, some on athletes, and that's all fine. But if you've got a true low back pain plus leg pain after a lifting injury, you want someone who thinks in terms of discs, nerves, and a phased plan, not just, you're right, you're tight, let's crack this. That shift starts with how you search. Section 3. Smart searches that actually surface disc-focused chiropractors. Let's upgrade the way you talk to Google. Right now, if you suspect a lumbar, herniated disc, and sciatica from lifting, your search needs 3 ingredients: what you think is going on, how it started, and where you are. Instead of chiropractor near me, try things like herniated disc, chiropractor, low back and leg pain, and then your city. Or sciatica chiropractor from lifting injury, and your city. Or non-surgical spinal decompression herniated disc, and your city. And finally, disc center low back and leg pain, and your city. The exact words don't have to be perfect. What matters is you include herniated disc, or sciatica, plus something like lifting or work injury, plus your city or neighborhood. When you do that, 2 useful things happen. First, you start seeing chiropractors and clinics that actually use this language on their website and profiles. They talk about disc problems, sciatica, nerve pain, and decompression. Second, you filter down a lot of generic results that might be fine for simple back tightness, but are not clearly built around disc patients trying to avoid surgery. As you skim the results, look for phrases like disc center, herniated disc treatment, non-surgical spinal decompression, sciatica and leg pain, or even before you choose surgery. Literally, look for the phrase before you choose surgery. Those are signs you're not just looking at a generalist. You're looking in the right neighborhood, pun intended, for a disc-focused chiropractic. Section 4. How to qualify a disc-focused chiropractor. Once you have a short list of 2 or 3 options that look promising, it's time to qualify them. You don't need medical training to do this. You just need to slow down and look for a few specific signals. First, do they clearly treat disc and sciatica cases? On their website or profile, do you actually see words like herniated disc, bulging disc protrusion, degenerative disc, sciatica, or leg pain? If they never mention discs or leg symptoms, you have far less evidence that disc cases are a big part of their world. Second, do they explain their evaluation process? You want to see at least a short description of what happens at that first visit. Do they mention taking a detailed history, doing orthopedic and neurological testing, and reviewing x-rays or MRI if you've had them? Or Is it all about quick adjustments and packages without much talk about how they figure out what's actually going on? Third, do they talk about non-surgical decompression or some kind of structured disc plan? Many disc-focused clinics will transcribe traction or decompression tables and explain that over a series of visits. They aim to generally reduce pressure on the disc and nerve. That tells you they understand discs heal under the right conditions and over time, not in one magic session. Fourth, do their patient stories sound like you? Read a few reviews. You're looking for people who say things like herniated disc, sciatica down my leg, my MRI showed a disc, I avoided surgery, I got back to work, or back to the gym, aftercare. If every review is just my back feels great, nice staff, that does not tell you much about disc outcomes, or if it's part of their practice at all. Finally, are they honest about limits? Somewhere in their material or when you talk to them, do you want to hear that they know when to refer for injections, a surgical consult, or other specialists? Anyone who promises to fix every disc for every person, no matter what, in a set number of visits, is not dealing in reality. Look for confidence, not denial. Section 5. What to ask before you schedule. Before you hand over your time, money, and hope, pick up the phone and ask a few direct questions. You don't need to sound technical. You just need to be clear. Question 1. Do you regularly treat patients with lumbar disc herniations and sciatica from lifting injuries? Let them answer in their own word. And what you're listening for is something like, yes, we see that a lot, ideally followed by a short description of how those patients typically do, and maybe some mention of when those patients get referred out. Question 2. What does your evaluation look like for someone with my symptoms? A strong answer will mention talking through how it started, doing a physical exam, checking nerve function, and reviewing any imaging you have, not just we'll get you adjusted and see. Question 3. Do you offer non-surgical options like spinal decompression or a structured disc program? If they do, they'll usually explain how it works and how many visits a typical plan involves. If they don't, that doesn't automatically disqualify them, but you want to understand what their non-surgical plan actually looks like. Question 4. When do you decide it's time to refer someone out for injections or a surgical opinion? This one is big. A trustworthy answer sounds like, we give conservative care a fair shot, and if we don't see progress or if certain red flag symptoms show up, we'll get you to the right specialist. You want someone who is on your side, not someone whose ego depends on being the only person you see. If you can get clear, grounded answers to those 4 questions, you'll have a much better sense of whether this chiropractor should be your guide for the next phase of your disc journey. Section 6. A realistic path back from a lifting-related disc injury. Let's zoom out and talk about what a realistic path can look like if you're trying to avoid surgery and get your life back. In a lot of cases, the journey has 3 overlapping phases. Phase 1 is about calming the fire. The first goal is to reduce the intense back and leg pain enough that you can function. That might involve targeted adjustments, decompression, gentle movement, short-term medication guided by a medical provider, and avoiding the positions and activities that light your nerve up. Phase 2 is about restoring movement and strength. Once the worst of the pain settles, you gradually earn back better movement. That can mean learning how to sit, stand, bend, and lift in ways that don't keep irritating the disc. Building some core and hip strength, and starting very specific stretches and exercises that your provider is comfortable with. Phase 3 is about returning to real life and work. That's when you and your provider look at what your actual days look like. Your job, your family responsibilities, your hobbies, and build a plan for getting you back there without repeating the same mistake that got you hurt. That might mean modifying how you lift at work, how you train at the gym, or how long you sit at a desk. Most disc cases that are going to improve with conservative care show meaningful change somewhere in that first 4 to 12 week window, as long as you're working with someone who actually treats disc patients and you're doing your part between visits. You're not trying to hack your way to a pain-free day. You're following a process. Your job is not to become a spine expert overnight. Your job is to pick a good guide, ask smart questions, and then stay engaged long enough for your body to respond. Frequently asked questions about herniated discs and chiropractors. Question 1. Should I always try conservative care before thinking about surgery for a herniated disc? Not always, but in many situations, yes. If you don't have severe red flag symptoms like serious leg weakness or loss of bowel or bladder control, a lot of people start with a structured period of non-surgical care. The key is doing it with someone who actually treats discs and sciatica cases, not hoping it just goes away on its own. Question 2. How do I know if my sciatica is serious enough that I shouldn't wait for surgery? If you notice new or worsening leg weakness, trouble controlling your bladder or bowels, or rapidly worsening pain that you can't get on top of, those are reasons to seek urgent medical evaluation instead of waiting weeks. When in doubt, get checked in person. Question 3. What should I look for in a chiropractor if my MRI already shows a herniated disc? Look for someone who talks about disc and nerve problems on their site, explains their evaluation process, and is comfortable working with existing imagery. You want a plan that sounds structured, not a one-size-fits-all. Question 4. How long should I give non-surgical care before I think about injections or back surgery? This depends on your case, but a common pattern is to give you a focused, consistent block of several weeks to a few months of conservative care. As long as you're seeing some signs of improvement and no red flag symptoms, then if nothing is changing or if things are getting worse, that's a sign to talk to your providers about the next step. Question 5. Can I ever get back to lifting or the work I was doing before? Many people with disc injuries do get back to lifting and to doing physically demanding work, but the path back is gradual. The goal is not to get you out of pain, but to change how you move, how you lift, and how you recover so you're not constantly flirting with the same injury. Closing. Your next step. If this episode sounded uncomfortably familiar, the lift, the low back pain, the leg symptoms, the fear of surgery, your next step is simple. Use one of the more specific search phrases we talked about. Find a handful of disc-focused chiropractors or disc centers near you. Run them through the checklist. And call 1 or 2 to ask the questions from this episode. You don't have to fix everything today. You just have to stop guessing alone and start working with the right person for this specific injury. That's it for this episode of After Injuries. If you know someone who did that one lift and hasn't been the same since, send this to them so they can stop doom scrolling and start taking a smarter next step. Don't forget to like and subscribe anywhere you listen to this podcast and or After Injuries YouTube. And if you are a multi-location chiropractor office, you can contact us through the After Injuries podcast website, or you can do an audit of your own office authority as the local expert in your case types by visiting visible.info. Connecting your Google business setup without sharing passwords and running an audit of your authority in key lanes. That's visible.info.